Coming to Geisinger AP5, I must say, it was like I fit right in. The atmosphere in AP5, the teamwork, the management, they've been welcoming to us as international nurses. And Geisinger as a facility on a whole, just the way they treat nurses, the way they foster your growth, always pushing you to go further. It has definitely impacted on me as well. When we heard that our unit was becoming the COVID unit for patients, initially you had that anxiety and the fear of the unknown. But then when you sit back and you really think about it, it's just the same as dealing with any other contagious condition. You have to be in your appropriate personal protective equipment. You follow the rules, you follow the guidelines. We were provided scrubs to wear at work. So we would come in our regular scrubs, we'd work in those scrubs, take those off, then put our scrubs on to go home. Then when you went home, I wouldn't want to touch my son. I'd tell him to stay over his section of the house, and I'd go straight to the bathroom, disrobe, get cleaned up, go back, wipe my car down with antibacterial wipes, wipe the door handles with Lysol, just go back, wipe everything that I know I've touched, and I'd still be scared. You always hear about persons who are positive but asymptomatic. So for the first couple of weeks, I was scared just to hug or kiss him. And the point is, we're still going through it. It hasn't ended. And no one knows the road ahead. You realize after a time when you started to get more familiar with the condition that it's just the fear of the unknown. Then there came a point where I was like, I had to hug him. I had to kiss my son. My contract with Geisinger is for 3 years. However, I made that decision to sign on, to stay on with my AP5 family.